All right, good afternoon, everyone. Welcome to the HVRP quarterly listening session. Thank you for joining. We have great attendance, still folks entering in from the lobby and joining. So to respect everyone's time, we're going to start right away. My name is Chris Brown. I am the National HVRP lead. The last time I was with you all was this past summer during our post-award conference. I was at some regional post-award conferences and had some other opportunities at the NCHV conference to connect with everyone. So virtually, it's nice to see a bunch of common names that do attend our presentations. For keeping my bandwidth up, I am going to turn my camera off, but I will turn it back on at the end for that human touch if we have any questions to go back and forth. Today's listening session, I'm going to go over the house rules that we have, an overview of VETS' policy guidance, some updates that have occurred since we've last been together during the post-award conference, the policies for HVRP actively, and then I'm going to get into VPL 0624, which was publicly released on 9/30/2024. Going to go over the sections, an overview of each, and then today we're going to dive a little bit more into eligibility, considering eligibility for the program is how we get enrollments. Taking the hour today to go over that section with you in depth is great. I just want to give everyone the opportunity and a disclaimer that this is an overview, and the degree of depth will be learned from this policy by reading it, working with your GOTR, and also the National Veterans Technical Assistance Center. So our house rules, this session is being recorded. We request that you mute all your microphones and raise your hand. All questions that you may have, even if you do want to ask one verbally, please put it in the chat. We can get to it either at the end of the presentation or a natural pause if time permits. If we don't get to it today, it'll be answered in our very robust Q&A document that we post within about a week or two after our listening session. The copy of the slide deck for today is already posted on the NVTAC website. The Q&A document and the recording will follow. Like I said, I try to be about 10 days, but depending on the amount of questions, the complexity, we strive for within the next 2 weeks. And also, we don't authorize attendees to use electronic or mechanical recording devices during this meeting. That's meaning like invitations to bots to jump into the meeting. So please don't do that. The only authorized recorders for this meeting are VETS' contracted support. So just a little bit of a refresher on policy. VPLs are the policies that our grant recipients are bound by in administering the HVRP. Grant officers' memoranda or GO memos communicate change in processes where actions are required within a specific time period. The best example on use of this is every year for grant recipients on or around the holidays, we communicate how a grant recipient is going to submit a request for incremental funding for their second or third year of the period of performance. Those are instances in where we would issue a GO memo. But for VPLs, they take a while to publish. They're very detailed to communicate policy requirements of the HVRP and live on our active policy directory along with the GO memos. This is a live hyperlink. Hopefully, in learning from our post-award conference, that the active policy directory is already hyperlinked in your web browser. Our HVRP policies do have resources related to them to help our grant recipients understand the application of the policy, technical direction on how to create work products, or the acceptable ways to complete standard forms. Technical assistance guides are the how and why to VPLs in our GO memos and provide greater depth on the subject that is written in a policy issuance. So this is a snapshot of our active policies right now as they relate to HVRP, the VPLs. Active policy guidance for HVRP. This is something that within the last couple of years, HVRP has known to either have outdated policies or many policies. But right now, we have three. That's the policy that we're presenting on today, VPL 0624, and the two other ones. One relating to amendments to your HVRP award and the performance management and reporting. Those are complemented by an annually published GO memo stating how you're going to request incremental funding for your second or third program year. We hope that the grant recipients who have hung in over the years with no policy guidance or outdated policy guidance as it pertains to the 3-year period of performance, we're happy to show that these three policies are here to stay. We don't anticipate the requirement for any more. VPL 0624 is our foundational programmatic policy that grant recipients traditionally have to wait and see for when the FOA comes out to see how the HVRP has changed and what's required of them as it relates to maybe some reporting requirements or its requirements relating to the a particular service of the population. What we wanted to bring to the table here in HVRP is consistency and predictability. It's paramount in ensuring you're able to provide a great grant program to our veterans that are at risk of homelessness or experiencing homelessness. So with this policy issuance comes rescissions, and rescissions, plainly stated, is rescind, cancel, revoke, remove from our HVRP website any active guidance or resources, materials we take down from our website, we update training materials, and those policies themselves go into the inactive policy directory because they're still publicly available to be reviewed, but they're no longer active for the program. So these rescind policies are just in number in what was required in them. Today, you're going to learn about how VPL 0624 has changed eligibility, as well as the grant recipient and participant relationship with the AJC. We still have participant eligibility requirements, and working with the AJC is a requirement of the program. However, how it was communicated is in these policies is no longer applicable to the HVRP. So the anatomy of our VPL, it's a big policy. So we plan to highlight each section, but hone in today on eligibility, future listening sessions, on a quarterly basis. Hopefully we can all get together. We'll cover topics on other sections, as well as in consideration of topics for our annual National Post Award Conference, we can offer refreshers. So the section is broken down by specific topics that cover eligibility, project requirements, participant file maintenance, functions of the HVRP staff. This slide's particularly important because as it relates to the topics that the VPL cover, this is where they were formally communicated. So you can see participant eligibility was VPL 0223. The project requirements that are outlined in section 6 are formally outlined in our annual funding opportunity announcement. And those can change from year to year. Participant file maintenance requirements, they were communicated in the terms and conditions, and then also previously we were silent on participant file maintenance requirements, so we fully addressed that. And then the functions of the HVRP staff, the services provided to the veterans experiencing homelessness. That's been formally outlined in our annual FOAS project design, but is now in policy. It is what it was required for the services to be provided to our veterans that are experiencing or are at risk of homelessness. Participant support cost. Just this past year in the FY24 FOA, we outlined participant support costs as well as incentives. So we needed to, with this policy, have the foundational framework so that all of our grant recipients can know that participant support costs are allowable, what the program can and can't pay for, as well as incentives, and also developing the procedures to ensure that risk is mitigated with potential misuse of the funds. And then monitoring the HVRP. Formerly, we addressed that in VPL 0223 that we were going to conduct reviews for to ensure the participants were enrolled in the program were eligible, as well as 0324, but we didn't really communicate what the grant recipient should expect with our monitoring efforts. So that is also included in the VPL. So grant recipient project requirements. All HVRP grant recipients receiving an award beginning in program year 24 must contact the National Veterans Technical Assistance Center to schedule and complete an introductory consultation within the first quarter of their period of performance. Grant recipients are also required to participate in the NVTAC training and technical assistance activities and when required by their GOTR. As it relates to standard operating procedures, there's specific standard operating procedures that our grant recipients are required to have and maintain. As an example of participant support costs, participant incentive costs, and then we outline minimally what's required to be had in these SOPs. Financial administrative policies and procedures. You can't run an HVRP without having organizational policies and procedures that will keep your program in compliance with 2 CFR 200. If you don't have policies and procedures written to address these elements, then how do you know you're in compliance with 2 CFR 200? We want to minimize risks that our recipients bear by communicating these requirements. Continuity of operations plan, public communications. These are items that were traditionally communicated in the funding opportunity announcements yearly that are now memorialized in the VPL. This is very important. Not just are we talking about participant records, but your financial records as well. Documentation must be available. Therefore, you must produce documentation in the normal routine order of business. So as it relates to expenditures, the maintenance and upkeep of the participant file, don't wait to receive the notice of an OSR or if VETS is going to conduct a performance audit to produce these documents. Produce them as you're actively creating a record. Do we have any questions? Sorry, I was looking at the chat. All right. Thank you so much, Christina, for throwing resources in the chat. We really appreciate it. So the veteran status eligibility documentation must be included in the participant case file. If documentation received determines that the participant is ineligible, expenditures for participant support costs or incentive costs for the individual may be considered unallowable, and the grant recipient must immediately remove the individual from the performance reports. That is very important why you need to hone in on documentation of veteran status and at risk of homelessness. We have in this policy communicated how to work with your GOTR in terms of if you're unable to get the supporting documentation as it relates to veteran status. But just be mindful of, we do allow the conditional of enrollment absent the DD 214. But if the individual is determined to have not been a veteran and participant support and incentive costs are spent on them, those funds may have to be repaid. So, functions that traditionally communicated in the FOA are now required. These 7 functions here are super important to your HVRP program, and I know many on this call it resonates because it has to deal with the day-to-day of their job. Outreach, intake and enrollment, and that includes enrollment into VETS's grantee reporting system. I know many on the call are participating in training and support sessions for Vigorous. We cover the use of Vigorous in this policy. Case management, the 3 components of case management being the needs assessment, the IEP, and employment and supportive services. Collaboration with our partner programs, training, of course, job placement, and then follow-up services. All is outlined within the VPL, and it's here to stay. These requirements are not going to change from year to year or have any type of tweaks. So please learn them, incorporate them into your HVRP. So the veteran status eligibility documentation is critical. It must be included in the participant case file. If documentation received determines that the participant is ineligible, expenditures for participant support costs or incentive costs for the individual may be considered unallowable, and the grant recipient must immediately remove the individual from the performance reports. I said that before, and I'm saying it again because we are addressing the allowability of participant support costs. We do identify what HVRP will pay for. We also identify what HVRP won't pay for. But they are participant support costs. They are participant incentives. That conditional enrollment, absent the verification of veteran status or homelessness status documentation, that needs to be followed up upon to ensure that the individual does meet eligibility requirements, especially if you're expending funds on them. The SOP that we communicate that's a requirement for having participant support costs as a part of your program and incentives has an SOP that has the framework of that. So you must ensure that they are eligible to receive that benefit. Incentives, providing participant support costs. We have an outlined SOP relating to incentives so recipients can establish the ability to minimize their own internal risk. So please review the SOP criteria. We have a disbursement policy tracking system framework that grant recipients can easily adopt. DOL Vets, Office of Grants and Training, we're in the process of revising the GOTR Oversight and Monitoring Program in consideration of all the active HVRP policies, and that's 3 of them that we have. Also, the grant recipients' compliance in accordance with 2 CFR 200 and the terms and conditions of their grant agreement. With identifying the on-site review and the HVRP, we wanted to have a transparent showmanship of how VETS is going to monitor the program. So grant recipients can now expect what to receive as it relates to the OSR, as well as what's going to be required of them. We've already told you a few slides ago that you're required to create and maintain records. Everything that is in this VPL essentially becomes reviewable, and how and what's going to be reviewed will be communicated with you, how, the timeline, and the method of receiving a report. Newer to HVRP, and for those of you that were in our post-award conference, grant recipients received a session this year on audit results and a debrief on how to avoid findings for financial audits. So that training was catered to the audit of the HVRP grant recipients. HVRP is going to continue to have valuations for program costs for financial compliance. We contract with a contractor to do this. The contractor is an authorized representative of VETS, and we're doing this to help our grant recipients and help the program, because any grant recipient can benefit from an audit, a validation that they're doing the right thing, or how to do something better, right? So every year we will be having training as it relates to a debrief on how the previous program year went when we did our audit cycle. How we select them is based on risk, and we outline it within the VPL. So if you are a recipient of a performance audit, it doesn't necessarily mean that it's a bad thing, but VETS has the capacity to do a certain percentage a year, and we select them sometimes at random, and others we look at risk. So if you are subject of one of those performance audits, please work with your GOTR, please work with the authorized representative. we're here to help you and ensure that you're successful. So required, our GOTR, NVTAC, NVTI, we're all here for you. The issuance of this policy may take time to implement and to become familiar with. We will continue to build capacity for operating the program in accordance with our 3 active VPLs. We want to ensure that you're providing the best services to veterans experiencing or at risk of homelessness, have the training and learning opportunities to implement the program while fostering a great relationship with your GOTR and your coaches from NVTAC. And the policy is large, in considering that it also has a very great appendix. So please take the time to review it, to ask questions from your GOTR. We are actively working to ensure that our HVRP website and our NVTAC website and materials and training courses from NVTI will be updated to reflect all of the policy revisions and policy inclusions from VPL 0624 and even with VPL 0424 and 0324. About 22 minutes in, before we take a deeper dive into eligibility, I'm going to pause for any questions. All right. Everybody ready to go into eligibility? Perfect. All right, nice. I've got a thumbs up. So we're all awake. All right. All right. As I said in the beginning, it's a good size policy, but we have a great appendix with definitions supporting the policy. So for those of you who have reviewed it, I hope you enjoy the direct link within the PDF to the appendix's terms. It helps navigate. Did I see a hand? Thumbs up. Okay. It helps navigate the different terms in their meaning in depth. So essentially, if you look at the sections of the VPL, the most hyperlinked is obviously within eligibility, and it brings you right down to the definition that we use rather than discuss it within that section and make that section a little bit longer. We took the framework with it. You asked, we listened. We issued 0223. We had a robust Q&A. We had a lot of feedback from our grant recipients and our vet staff, as well as had the opportunity to measure performance. We hope HVRP eligibility is made easier on the grant recipients for outreach, intake, and enrollment. This is the highlights and major differences from the previous standalone VPL on eligibility. Compared to VPL 0624. I want to say this very slowly. Income is no longer the base criterion to meet in order to qualify their status as at risk of homelessness. So check out the appendix, follow along here. We're going to take you down this 6-step process. And also, and I'll say this very slowly, we're maintaining no limit on the percentage of enrollment of veterans into the grant program who meet the definition of being at risk of homelessness. So that 10% ceiling, there is that does not exist anymore for the HVRP program. So this may look familiar from the Q&A document. And again, that Q&A document that we had was a product and the results of you, our grant recipients. When 0223 came out, there were a lot of questions, and those questions were basically listening from the field, listening from the staff that are providing the services to the grant recipient, to the grant, sorry, not to the grant recipient, the participants of the program. And how to determine that they're eligible, and how to navigate VETS's policies. And the questions that you asked created this very big Q&A document to where we're like, well, if we can take eligibility and create a flow chart for our case managers and our assessors to follow, a picture could be worth thousands of words, right? So a lot of things that we could have communicated in writing and policy, we wanted to use this flow chart. So there's 6 steps to determine eligibility here, and broken down within the VPL, we have our tables, and our tables at each step is the types of documentation required and the documentation standards. Because remember, we are going to conduct site visits to determine the quality of the program and the compliance with it. So we give you a cheat sheet saying that essentially, like, here's the standards at each step, the required documentation, and then what that looks like. And then we also say what must be contained in the participant file. So this VPL is just tying it all together for everyone in one nice safe spot. So the tables described the documentation associated with each step. The table is also in the, this flow chart is also in the VPL itself. So what we did here for the purposes of this presentation was to start out at the beginning. What is an eligible veteran? VPL 0223 previously addressed HVRP eligibility for those who serve or have served the National Guard or Reserve. This is not new. We've been able to, since VPL 0223, we addressed the criterion for National Guard and Reserve members to qualify for HVRP service to meet the definition of veteran under the law for HVRP. To documentation of veteran status. So a little bit different here is you have to include the DD-214 or VA summary of benefits letter or military orders under the conditions that are here. The DD-214, VA summary of benefits letter, or military orders, given the conditions, must be requested through the participant or other applicable entities or resources within 3 business days of enrollment and must be included in the case file. This is 100% essential. It's not going away. The program will always require the DD-214. The summary of benefits letter and the applicable military orders. These are for instances where a participant who is an assessed individual that meets the criterion here as a veteran that is a member of the Guard or Reserve that were not issued a DD-214. That's where you get the summary of benefits letter or the orders. It is not a substitute for the inability to obtain a DD-214. It's when they were not issued one. There is service in the uniform services to where an individual will not receive a DD-214. Vets acknowledges that. Vets heard from grant recipients that have actively worked with members of the Guard and Reserve who are experiencing homelessness, who have qualifying active duty, and the Department of Defense or their branch is not issuing a DD-214 based on the time or the type of duty. So there is a difference between not having been issued a DD-214 and not possessing it. So very big difference there. The key takeaway, work with your GOTR. Everyone's service experience is different in the military. If you had a situation or a circumstance regarding a member of the Guard and Reserve, please enter it in the chat. We'll include it in the robust Q&A to answer it if there is any confusion. 0223 did come out at the beginning of 2023. We're at the tail end of 2024. Again, if we can't create better policy Q&A documents without hearing how it's going in the field. So please let us know how it is going with providing services to those qualified members of the Guard and Reserve. So categories of HVRP eligibility. There's 4 of them, right? So once the HVRP program definition of veteran is met, there are 4 categories a eligible veteran that would further make them eligible for HVRP. The veteran that's experiencing homelessness, the veteran participating in a partner program, a veteran transitioning from certain institutions, and a veteran who is at risk of homelessness. The first population experiencing homelessness must meet the at risk of homelessness criteria. Also, veterans recently released from incarceration within the last 18 months who are also at risk of homelessness are eligible. That did switch from 12 to 18. These are just examples on how to document homelessness status to include documentation to justify the determination of homelessness status in the participant case file. Some circumstances of homelessness, such as a veteran living in a car, park, abandoned building, bus or train station, will not have documentation to provide. These circumstances must be documented within the participant case file, but if no documentation exists, self-attestation can be used in these circumstances for that. Again, further documentation for the at-risk of homelessness status, eviction notice, income statement, referral from a partner program, welfare public assistance documentation, or other information relevant to a veteran at risk of homelessness situation. You know, we don't want to disclude any information that could help verify that they would meet the eligibility criteria as it relates to their homelessness. So we did not create an exclusive list. These are just inclusive items. At risk of homelessness, redefined. So to be considered at risk of homelessness for HVRP services, the veteran must meet at least one of the criteria below. Veteran who meets the condition of extremely low income. Extremely low income you'll see as a footnote on the policy. HUD sets the family income limits for its housing programs, including extremely low income. So ELI is defined as a very low income whose income does not exceed the greater of 30% of the median family income for the area, or the federally poverty guidelines as published by the Department of Health and Human Services. That is not necessarily a gateway into the meeting the criterion for at risk of homelessness any longer. So it's at least one of the criteria that they are extremely low income, that they are a recipient of welfare or public assistance, or that they have been referred from one of the following VA programs that we have heard from our grant recipients that for veterans experiencing or at risk of homelessness commonly have participation with these programs. So we added it to our at risk of homelessness criterion. And then veterans who are at risk of currently losing their housing. How these may be documented, it's taking the individual when you're doing the assessment and applying being as humanly understanding of their situation as possible, and not all of these factors can necessarily be documented, but from a good intake and assessment, you may be able to gain enough information that that satisfies the requirements of the HVRP. So I'm going to pause for questions. Ms. Marie Lopez, is HMIS documentation still acceptable? What documentation do you retrieve from the HMIS system? Proof of enrollment in homeless programs. Correct. Proof of previous enrollment. Case notes from HMIS. Christina, you have your hand up?
Yes, previously Susanna had put in the chat for the PY question mark, and just wanted to get clarification on what her question referred to with the program year. so we can make sure it's answered correctly in the Q&A?
Okay, I'm sorry. Yeah, apologies. It's hard to present, drive, and then see the questions in the chat. So, Susanna, you asked for this program year. What was your question in reference to? It is for at-risk enrollment that is now the current definition. So you can begin assessing individuals under the criterion listed in VPL 0624. All right. So going back to Marie, it depends on the HMIS documentation, proof of enrollment in homeless programs. If it shows proof of enrollment in one of the partner programs that HVRP allows, absolutely. There is no substitution for the DD 214, whether or not the partner program that is listed in the VPL is administered from the VBA. Just that alone does not negate the requirement to collect the DD 214 from the participant. I just wanted to be clear on that too. Can a veteran, so I believe, so Anthony, can a veteran self-attest to being at risk, or must there be documentation from third-party attestation to this? So if we go back to the criteria, conducting an assessment on the individual as it relates to their situation or circumstance. So if they're at risk of losing their housing, I leave it to the experts in asking the questions on determining whether or not their self-attestation meets the requirement as they're describing it. So for instance, if they are at risk of losing their current housing and they're unemployed or underemployed, that can be met with self-attestation. Dan Simpson. If veterans transitioning from certain institutions are only considered eligible if they are at risk and they are already classified as at risk of homelessness, what is the difference between being categorized as at risk in the context versus being classified under the general at risk of homelessness category? Can you speak to the nuanced difference? Sorry, the difference between at risk versus veteran at risk from an institution. So an individual, actually, Daniel, if you don't mind, I'm gonna save that for our robust Q&A document, because I don't want to necessarily speak at a turn, but I do want to be able to address it fully for our entire audience, because you do bring up a good point that doesn't require clarification. So thank you, and it will be contributed to our Q&A document for the session. And Sarah, thank you for the reference. Daniel, if it does not talk about, if it doesn't speak to your question, like I said, I will absolutely address it in the Q&A document for the good of our HVRP community. Are there any other questions? I'm sure everybody has their VPL broken out right now, looking through it, whether it's the question doesn't necessarily need to be related to eligibility. It could be from any of the other sections that we have. It could be relating to anything ongoing as it relates to our other policies that are available on performance and management, or our award amendments, or the upcoming grant officer memorandum on incremental funding. I have a hand. Lena, do I have the ability to unmute you? Let me see. Will someone unmute Lena, please?
Lena, you should be able to unmute now.
Hello. Hi.
Hey, good day,
Hi,
depending on where
buddy.
you
How you
are.
doing? Nice to speak with everybody. I don't know if this is a proper place, but is there a new process on getting an NY number for the veterans with the DOL? Because it used to be with Joanne, just directly through her, but now it's like we go through another system and then we go through Joanne to get the NY number for the veterans.
Nationally, the HVRP does not assign a ID to the participant.
Okay.
Are there other programs that your organization administers?
I'm strictly in the employment, for I integrate, the homeless veterans into employment. I'm the employment coordinator, and we get NY numbers for the, veterans, through DOL. We get the, NY numbers.
NY numbers. What is the acronym?
It's for DOL, New York number, NY number. Instead of them putting their social security number, they would put their NY number, so it's more secure, more safe for them to put that number instead of the social security number. It's like an identification number. They get to use the DOL resources. They can go into their
Okay, so that is so you're talking about the participant ID with the American Job Center.
yes.
Yeah, so while HVRP is a partner program, HVRP does not control or assign the participant IDs at the American Job Center.
Okay.
All right.
Thank you.
You're welcome. All right, another hand. This is awesome. Nina, am I saying your name? I hope I'm saying your name correctly. Nina Severd, you should be able to unmute.
And to the other young lady in employment and training in New York State. And then you nailed it by saying it's a one-stop operating system. At Veterans Outreach Center in Rochester, we have both a GVOP on-site weekly, as well as our AJC partner on-site weekly. But we have access ourselves to the one-stop operating system, so we can actually start the process and enter our own veterans in there, and then can create the referral to our DVOP via that route, as well as get them enrolled as an HVRP participant.
Absolutely, you can. But I do want to say that this policy strongly encourages co-enrollment with the AJC and any of the programs under WEO. Having the partner programs, whether it's with the VA, whether it's with the DOL, American Job Centers, and just the relationship that you're describing for everyone on this call that you have being integrated with the DevOps and the system is awesome. There is not a requirement for the participant to be co-enrolled, and that is one of the larger differences and takeaways, is that requirement's been eliminated. So for some of our the administrators of the grant program, you've been accustomed to since 2016 annually giving a grant number to a DVOP or the AJC. we're not collecting. The AJC is not collecting those grant numbers. They do have they will be rescinding a TEGL at some point that had them collecting them. We also rescinded the grant officer memorandum that said what digit characters we provide the AJC. However, we strongly encourage co-enrollment, and we always will, especially within our partner program, the Jobs for Veterans State Grant. So please keep doing what you're doing, but it is not necessarily a requirement. Sarah?
Hello, good afternoon, everyone. Sarah Bierman, Deputy Director for the Office of Grants and Training. Just kind of wanted to foot stomp what Chris is saying. Chris is exactly right. We did issue VPL 0524. For those who are familiar with that VPL, I do encourage you to go to our VPL directory and check that out. Maybe Christina or someone can just shoot the link in there for that as well. So we did provide guidance out to our JVSG grant recipients, the Jobs for Veterans State Grant, information on the collaboration between HVRP and the American Job Centers. But like Chris said, the Employment and Training Administration will work on rescinding their TEGL that speaks to the co-enrollment, but we still expect to see the collaboration just because of the great benefits. So the VPL does speak to that. VPL 0524 does speak to it as well. And just want to, there's not a requirement to give the grant numbers back and forth, but we still want to see the collaboration and work together because they do provide some really great services that we can leverage with HVRP and vice versa. And we also want there to be referrals back and forth. So you'll see that in VPL 0524 as well. And again, just because that there isn't a requirement for the HVRP grant recipient to provide the grant number, that's the part that we are rescinding. So thank you, Chris, for explaining that. Oh, the last thing I wanted to explain is that because ETA is working on rescinding that TEGL, there might be a little bit of time in there if you as grant recipients have any questions or concerns working with your American Job Centers and they're looking for that grant number, please reach out to your GOTR and they can help facilitate that technical assistance with your state workforce agency, with the American Job Center, and help you through that and explain things as well. So thank you.
All right. Nina, did you have a follow-up?
Yeah, I'm not going to discourage myself and my team from doing that. I think it's still very beneficial to our veterans, especially when we have our AJC partner on site and we are completing the referral form, or if they're already entered, it speeds up the process when they're meeting with a veteran, because we have developed such a strong relationship with our AJC, which is Rochester Works. And we've gotten a lot of veterans into some are private foundation grants that they happen to have locally for recovery coach peer mentoring training. And we put quite a few of our veterans through CDL training, and they've been able to access close to 5,000 for the CDLA training. And then through a private foundation donation that we receive, we can pay the balance of that training. And the peer recovery coach training on average is costing $4,000, and our AJC is paying for that. And right now we have had 1, 2, 3 of our veterans that are currently doing internships in that area here at Veterans Outreach Center. So
I have to
I
say,
think
you're
it's
doing
a
the
really
right thing.
great benefit.
Yeah, you're doing the right thing because VPL and you should get the if I had a gold star, I would give it to you because collaboration is required, and collaboration with the American Job Center network is required in this VPL. Really, if it boils down to, like, it plainly speaking, is giving that grant number to the AJC and requiring the participant be co-enrolled has been eliminated. Collaboration with the AJC and in introducing and encouraging participation for the veteran experiencing homelessness with the AJC, you're doing already in compliance with VPL 0624. So continue to do what you're going to do. At some juncture, when the newness of this VPL wears off and a government minute happens, is that the AJC will know that we're no longer collecting the grant numbers, and that grant recipients will no longer need to memorize that 6-digit number to give to a participant. That's just it's no longer there. But the requirement with the AJC, you described it perfectly. So thank you for doing that for everyone on this call.
Thank you. And we'll still take the gold star though.
Yeah, I'll virtual gold star I can try to issue. So I get another question going down. If a veteran is living on the street, can they use the self-certification of homelessness form until they find shelter? So table 2, documentation of homelessness status. That's a part of step 2, right? If no documentation of homelessness status exists, self-attestation can be used in these circumstances to document a participant's homelessness status. I can't speak to the form, the self-certification of homelessness, whether it's an internal one, whether it's a continuum care form, but if you've created a form for an individual to complete to essentially self-attest, then it is acceptable, and it is written into the VPL to be acceptable. Next hand, I have Angie. Angie should be able to unmute.
Okay, so I had typed it up on the top, but I didn't want it to get missed. Can you speak to the vigorous requirement that's outlined in the VPL with regards to the 5-day requirement to enter participants?
Yeah, so so basically the 5-day requirement when this VPL, not necessarily the design of it was what can we put into this, but programmatically speaking, how do we address all of the requirements that we want to communicate for either the veteran, for the benefit of the veteran experiencing homelessness, or the benefit of the program administration from the grant recipient level to the federal level and all the way up to like the higher level reporting. So Vigorous is very new. This VPL is very new. A lot of newness for HVRP, right? But we're here to support you. So the 5-day requirement is because unlike dealing with the Excel-based forms, Vigorous tracks information in real time. So program managers, bigger grant recipient organizations that cover larger SDAs, multiple users of the Vigorous system, that 5-day requirement is in order for the good order of the program, right? So once you meet this 6-step process, and I'm sorry, once you're at step 5, right? You get to step 6 and they can benefit from employment services and your organization decides to enroll, you have 5 days to enroll them. It is a baseline, right? If they're not enrolled in 5 days and they're enrolled in 6 days, it's a threshold. It's a monitoring tool. It's a technique, but it's also for self-compliance, right? I remember a time when I was an assistant state director in Massachusetts and it became reporting time, and there was 35 enrollments, and the quarter ended, and the grant recipient had it was 3 feet of documentation sitting on a desk, getting ready to do the participant tab for our TPR. I said, "You're here to help me with entering this documentation." I said, "No, that's not my role." I said, "Why are you waiting until the end of the quarter to do this?" So in best practices that we've captured in listening for the field and seeing the capability that this system has, we established the 5-day to have enrollment for the good order of the program.
So I would just want to clarify, the ultimate goal was so that we were not waiting till the end of the quarter to enter all of the enrollments in.
No, that was an example of just poor management. The ultimate goal is to track performance in real time. So getting an individual enrolled in the HVRP program by completing the 6-step process within 5 days, entering them into vigorous program managers. Like I said, some organizations have a very small HVRP program and maybe 1 or 2 service delivery areas. Others are very robust. Others have grants that are nationally administered. And I know Dan, you're Simpson, you're on the call. To be able to track performance in real time is in having this 5-day requirement is maximizing the efficiency and effectiveness of not just necessarily reporting, but how to track all of your outcomes as they happen. The quarterly reporting component of it is the validation of the data on a quarterly basis. But since vets and HVRP doesn't have necessarily an MIS system, this is the next best thing. And we'll go back to Nina. Angie, you get a gold star because you flushed out of me the whole purpose of adding Vigorous to our great VPL. So gold star for you.
Oh, great. Thank you.
Thank you,
Well,
Angie.
speaking
Nina.
of my new friend Vigorous, it took me close to 5 days to do the data entry just for PY24 Q1. Between everything else I do and the incredibly slowness of this new system, our average entry for one participant has been, if it's fast, 15 minutes. And now with the requirement of entering all of program year 23, there's only 2 of us that are accessing the system to do the data entry. And that's going to take a while. We have never been late on grant reporting, and I honestly don't know if we'll have PY23 data entered into Vigorous by the time the reports are due. So
Understood.
that is a major stressor for me right now. I'm down some staff that are out on medical. I've been out on medical myself, and just the slowness of the system. And I mean, PY23 would be the Q5 report, which I have the retention done, and I did it early, and I had it done in the TPR just as a backup to document that we've done the work. But also in entering from PY23, some of the information doesn't transfer over well into the Vigorous system. It's not necessarily the same. So that's also causing questions from my assistant program manager asking me, how do I address that? So that is right now a challenge. I would love to have people that are already enrolled for October quarter, Q2, but I'm still busy doing a program year 23, and we've just started that. So that's, I'm going to tell you, this is the most stressed out I've been in a long time. It isn't the performance measures, it's just getting everything into a new system.
Yeah, and I hear it, Nina. I sympathize because everybody hates change and the way things are as it relates to some of the performance elements of this. But we do have the support available, like the technical support, but I know that that doesn't take away from the fact that the labor that you need to put into it, internally we're going to stress with our GOTRs, and then just rest assured that this is a transition to a new platform, and transition takes time. So it's almost like trying to change the tires on a vehicle that's moving. So, continue to, what I want to do to encourage you is that, how the HVRP, I know we're at the hour, so if anyone can stay with us, absolutely, I'm here for you. If you need to leave, I've covered all of the important things of VPL 0624. The recording will cease when this ends, and everybody will get a copy of the slides and the robust Q&A. So if you need to leave right now at 2:00 Eastern, feel free, but I'll stick around for everyone. So Nina, the support any issues, sending to vigorous@dol.gov. The feedback from our grant recipients is really important at the national level because like VPL 06 didn't, 0624 didn't just come up from because of one person's idea. It was years of hearing from federal staff, grant recipients, and also our customers, and how to try to get a product out there that for policy related to cover everything. So as it relates to going into Vigorous, this new territory of a new system that essentially replaced VOPAR that we had, if anybody remembers that
Oh, yeah.
that system. Okay. And then we had a bridge for a long time, which was the Excel-based form. So hang in there, but please, everyone, provide your feedback to the Vigorous email address. Attend all the sessions that are available, because so what we can do is to take any of your negative experiences and also communicate your good experiences, so we know what's going well with the system to see how we can continue to improve it, because we have the ability to improve it, but we can't improve upon what is not broken, what doesn't work well. So report anything and everything that could help us assist you. And I can't solve the data entry thing, but just hang in there and work with your GOTR. We're empathetic because we all have to learn the system ourselves too.
Thanks. I agree with somebody who commented, it is an easier system to use. It's just everything all at once to be done is, I guess, the greatest challenge.
Yeah. Hope and thankfully we only have to go through this once, right? And it's growing pains with something that's new. I do want to move on to Earl. Earl, thank you for figuratively holding your hand up for a while. So Earl, you can unmute yourself.
Can you hear me?
Yes.
Okay. Chris, I have a question that piggyback on what Nina was saying. My question is, if they know we're already having the 5-day thing, the 5-day putting the information in, could you explain that to me again? Because the situation we're having is we were told we weren't supposed to be able to put information into the system until all of PY23 is in. So how can that actually be tracking if that we can't put the new information in within 5 days? Because that's impossible to do with having to put PY23 in.
Yeah, and
then
yeah,
and
absolutely.
then when, at least for my company, my department, we have people out doing outreach and stuff and enrolling people in the out. So when they come back into the offices, especially if they're out in rural areas, they might not be back for a day or two. But when they come back, is that the actual 3-day or 5-day? How do you enroll that? When I thought the process was with Vigors, they didn't want us to put anything in until the end, because if there was a mistake added or something was submitted, that was a cancellation, and you couldn't change it. And then when we send it in, and it gets kicked back, we have to start over from zero anyway. So how do we have that 5-day initial tracking of information? It's not making sense to me. Like, if it gets kicked back, and if they know we're having situations of getting the information all in, then how is it possible to do it within 5 days? Or what my question to that is, no. The question would be, what is the grace period for once, if your TP, or I was about to say TPR, if your Vigors is kicked back, what are they giving us for a grace period? Because what I'm looking at now is the issue is everybody's on the system, and that's why I'm assuming that's why it's slow. So if people are going to be getting something kicked back, how are we going to get it back in a timely frame if the system is going to be running slow anyway? I know that was a lot. My fault, Chris.
All right. So, and
Chris?
yes.
Sorry, I just want to say I can jump in on that if you want.
Oh, absolutely. Thank you.
Sure thing. Hi, girl. It's Kate McCord. I've been, you may or may not have been hearing me in some of these technical assistance sessions, but I work with the system developers for VGRS. Wanted to make a couple of clarification issues. So the thing that you brought up about how is this 5-day turnaround time going to work when you are submitting your report and waiting for responses back? So I wanted to clarify there's two different things going on here. When we talk about the 5-day entry timeline in this VPL, we're speaking specifically to the sort of the grant record that as you are enrolling people, your PY24 enrollments, the ones that have started receiving services after July 1 of this year. That's the piece that that's speaking to, not your PY23. We understand that, again, this is a one-time issue with having to enter in old data. So we don't, there's no expectation for that. It's sort of as you're able to get that PY23 data in. I also want to clarify, it's not, we're not requiring that PY23 data be entered in prior to entering in your PY24. You can do them both at the same time. The system is able to tell the difference. And I want to clarify that the piece about, so when you submit your performance report, so that's different from the grant record side of the house. The performance report, that is still proceeding as normal. So you'll submit that when it's due, and then you'll get feedback from your GOTR, and that piece will work as expected. It is not, the VPL does not speak to that activity as far as timelines. So it's really only speaking to the data entry piece of it when you're entering enrollments. And again, I know Q1 is a little weird because we have so much data we're trying to enter in right now, but really kind of think of it as, from Q2 going forward, that's how we would expect it to go, because you would have all your PY23 data in, and you'd only have to be focusing on your new enrollments that are coming in and updating your existing participants, training and services and placements and all that good stuff. So does that help clarify the difference between the two?
It does some. So basically what you're saying is moving forward, like, because right now I can tell you my Q1 is not in because I was working on PY23. So I guess we're getting a pass on that. But you're saying Q2, if I was to enroll somebody today, I have 5 days to put them in the vigors, or I'm penalized or something?
You're not penalized because, as Chris mentioned earlier, we're not going in and checking. It's a benchmark or a guide. So, again, not letting things go for like waiting until the last 2 weeks of the quarter kind of a thing, right? Like it's because of their issues with system lag, things like that. That's the intention. So I do want to clarify, we're not giving you all a pass on PY23 Q data, because you still have to enter that in. You still need to provide follow-up data on those that exited, and if for anyone that still continues to receive services. So that's still expected to be entered, but you don't have to wait to enter your PY24 enrollments until those are done, if that makes sense. You can go ahead and enter those Q1 people in now.
Understood. Thank you.
Yeah, the biggest,
Sure thing.
before I moved, Kate, thank you so much. And before I move on to Tony, and I don't know where it went, Daniel, thank you for bringing up, you had talked about benchmarks with this policy. Yeah, it's a robust policy. We didn't want to wait to the juncture of the beginning or the end of a program year. There are certain things that within the grants that were awarded in 23 and in 24 mostly contain elements of what's required in this VPL is in their funding opportunity announcement prior to that. And then anything here with the suspense is that you have to think like bigger picture programmatically, is that we want to encourage the use of this system because it is a live system for grant recipients to see data in real time, enrollments, but also monitoring on vet side in real time. And establishing a benchmark of 5 days was something that we considered reasonable, that we kicked around, just like the request for the DD 214, that request must be made within three business days. That's something that's been in versions of VET's policy past, whether it's 0223 or 0121. We have to, whether or not VETS communicates it, the organization would have the need to create essentially the discipline to establish framework within the program for allowability, right? So having that 5 days for this, 3 days for that, if there's situations or circumstances where they're not being met, that's worked out with the GOTR, that's worked out with the organization. Like organizational management is the control of ensuring that the entire program comes into compliance with this VPL. We understand that it's pretty robust. We're also addressing vigorous right now with the 5-day requirement, while all these other vigorous requirements. So it will get ironed out. VETS is monitoring, meaning from our end of the quality of the HVRP from the grant recipient side, right, needs to evolve as well. Is because we roll out the policies, we need our grant recipients to take the time to understand, to implement change, and then execute, right? So 5 business days is what we internally agreed upon to do to publish within the guidance. But like our great contributors here, our great contributors during the publishing of VPL 02 2023, there was a need for change. The need for change, we listened to our grant recipients. That's one of the things that recently we've been pretty proud of, that we've gotten positive feedback on. So continue to provide that feedback, even if it's constructive, critical, we'll take it. But we understand it's going to take time to get everything in line with this policy. But we're confident that expanding the eligibility criteria was something that was a must that we needed to do in order to align with VPL 0524 as it relates to the AJC. We needed to get out some of the policy rescissions and just mainly how to communicate enrollment in a better way so we can increase enrollment for the HVRP. We broke down some of the barriers and misconceptions as it related to the at-risk of homelessness criteria. They now don't need to meet a combination of factors, including income, right? It's any one of them, including a host of programs that the VA sponsors, that if the individual is enrolled by default, they would be considered at risk of homelessness. So we could have absolutely delayed until everybody was the training wheels were off with vigorous, but that's just such a small component of a very large policy that the program needed. And once you see versions of funding opportunities announced in the future competitions, you will see that, oh yeah, we have VPL 0624 and there's nothing VETS is requiring us to change because we're applying this year, and it doesn't necessarily apply to any other year. So this was the best juncture that we could issue this policy, but we're here to help implement it. And that includes giving your organization the best technical assistance. I have Tony Cropper, and then I'm going to go look in the chat for others.
Okay, this is a Kate question, I'm pretty sure. So what is the ideal situation when it comes to entering data into Vigorous so that when we generate the quarter report, there would be let's say a minimum or no errors per se? I don't know if you follow my question. I'm really concerned about the grantee having the PY23 data in the budget and the participants. Do you follow the question?
So I do. I think maybe we need to potentially, because I think what's happening is this is turning into a vigorous conversation, and I don't want to. Right. Yeah. What I think we'll do is I'll speak with Sarah and Chris, and we'll think about what we need to do to get answers to your questions, as well as some of those questions that are popping up in the chat. But yes, we'll follow up with you, Tony, on that.
Okay. Yeah, and thank you, Tony. And then for the sake of time, if there's with this Q&A, it is, since vigorous is addressed in this policy, we will address the vigorous questions in the Q&A. Anthony, you had asked at 2:06, when will the PowerPoint document be emailed to us? The PowerPoint is actually on NVTAC's website under quarterly listening sessions right now. Next step for us is to produce the video and video. We don't have videos anymore, recordings. And then what we will do is complete the Q&A document. I know that, it is vigorous is the flavor of the month. Can't avoid that, but I will do everything to address the 0624 questions, as well as consult with the vigorous and performance team to address those, because I know that as our folks had stated that this is laborsome. There are a lot of concerns about getting things done on time, the anxiety and excitement of learning a new system. So I hear you. We are here to support. So I will see if there's any other questions. Okay. Eric Strong, and I apologize if I had missed you in this chat. Go ahead and please copy your and paste your question so it's fresh. If your question went unaddressed, what triggers the start time on 5 days? So the 5 days is enrollment. Includes conditional enrollments of veterans of the grant recipients. So that's when you've determined that this individual is eligible for HVRP and you're enrolling them. That's what triggers your 5 days. So that's up to you as an organization. Like I said, we want you to conditionally enroll grant recipients. Absolutely, until you get the documentation of veteran status. We know that it takes time for DD-214s, or if they're members of the Guard and Reserve, to get their own NGB 22 or orders. Absolutely conditionally enroll them. Accept that risk. You're working with the individual to know, and then enter them within 5 days once that determination is made. I can't speak to how an organization internally decides whether or not they enroll an HVRP participant, whether or not there's a certain vetting that occurs from a referral into enrollment. While we do have a 5-step process, that's a 5-step process for determining eligibility for HVRP. You may have your own internal organization decision on that 6-step process, would need or benefit from HVRP, and then enroll them. And then that clock can start at your own juncture. Karen Land.
Question, I don't know if you've answered this or not, but we are a 3rd-year grantee, and I just took a look at our report, and I know they said put the last year, the 2nd year, and the current grant year, but our 1st year is not in there, so it's giving us invalid information. It's giving us red for our quarter when we've met the enrollment goal, and I know that we had met most of our goals the previous quarter as well. So are we going to have to enter that 1st year data in order for us to get correct information?
Kate?
Yep. So if this is your third year, correct? I just wanted to make sure I got that.
Yes, ma'am.
Yes. Okay. So for the enrollment goals for the first 4 quarters of your period performance have been entered as 0. So if you're still getting a red, that means it's likely that you haven't finished entering in all your PY23 participants, possibly. So that would be
I'll have to check with our team to see, because I was wondering, because I looked on there were several places where I know we've met it and it's showing red. So I'll just make sure, I'll check with them to see. But I was just wondering, do we need to have that 1st year just to make sure Because otherwise it's giving us red, because we had 65 enrollments, but it's showing red for the quarter.
Yep. So yeah, the system we deliberately entered in 0 values for all of what would be your first year goals, so that wouldn't happen. So that's why I was thinking it might be something going on with one of the other year's participants. So we can.
Okay, I'll check, and then I'll check with the team, and then I'll let you know. Thank you so much. I really appreciate it.
Sure thing.
All right. So we have questions. Believe I am good on questions. And thank you for your comment, Daniel. I appreciate it. And it is a lot of pressure on our grant recipients to roll out a new system, to learn how to use it. And then here's a very large VPL. But our monitoring, which is in section 9, talks about the OSR, and as it stands right now, the important thing was to communicate this VPL. Like I said, the program requirements and functions. If you look at the last 2 years, if grant recipients were awarded initially in 2023, congratulations, you have a grant number that starts with a bunch of zeros and goes from 1 all the way to 72. And then we have some grants up in the hundreds because we just started using grant solutions. The point in that is the FOA development included a lot of these items, and it was deliberate because we wanted, and for the purposes of just exercising a lot of folks through this, is that we took past FOAs, multiple FOAs, as it relates to Section 6, Grant Recipient Project Requirements and Functions of HVRP Staff. So those things, plus this year, participant support costs and incentives were in the 24 FOA. A lot of this was put in policy that was already required in a funding opportunity announcement or in the terms and conditions. What we did not want to do was to overly burden grant recipients every year with changing their statement of work, or depending on the statement of work to have to be written in a different manner. So for those that are in their last year, their funding opportunity announcement might not have had all of the elements contained in Section 6 and Section 6 and Section 8. Section 7 was addressed in the previous 2 years' terms and conditions. We didn't want to have to change. Again, I'm kind of beating a dead horse, change from year to year. So we established this. Vets now has rolled out within, and as you all know here, but in the last 10 months, we've rolled out the 3 policies that are foundational to the HVRP. There's nothing new coming except for the grant officer memorandum that will be coming out this winter. And with that will be the opportunity for our grant recipients to learn and incorporate this into their HVRP program. A lot of this is already either being done or is being learned to be done. With that, we have our 3 foundational VPLs. This was the one that we wanted to not delay, but to deliver and ensure it had everything that we wanted into it. So it didn't get introduced at the beginning of the program year, a couple of months later, but the big takeaway is patience, time, learn it, apply it, and vets will get to the point where we can monitor it. As of right now, the on-site reviews that are conducted are being done in the way that they've been traditionally done, and I'm not going to talk about the on-site reviews today or any of the intricacies of that, but Vets is going to create a monitoring program for these 3 VPLs, the terms and conditions, to CFR, focusing on the quantity, focusing on corrective technical action that will help bring the grant recipients not only just into to compliance with VPL 0624, but with the efforts of creating a better program, because the elements that are in section 8, what we're saying that the program will pay for in section 9 and 10, we want to be able to ensure that your organization has the capacity to do so. And that's why we have the SOPs. That's why we've outlined a lot of the things, and to eliminate the guessing or what should be done. So take the time to learn it. Vets will work on a plan for monitoring. It will be very transparent, and as it's outlined in the VPL, and it will begin later on in the program year. As it relates to Vigorous, hang in there. We're working through it, and knowing Kate, she's committing a lot of time to ensure that the recipients and also the federal staff that are on here, their needs are met. So the system, everyone learns the system and becomes proficient in it, and that we are reporting as required. So one more thing before we go, because I think we got all the questions in here. Oh no, Karen, is there a timeline to update the goals in Vigorous to align with the grant's NOA?
I'll jump in on that, Chris. So the
Okay.
goals that are in Vigorous they do likely align with the most recently approved goal sheet, either at that was submitted during application or a approved goals change request. So if for whatever reason you believe that your goals are not accurately reflecting that, which it is possible we could have missed it, please send that to vgrs@dol.gov and let us know what goals you think might be incorrect.
Yeah, absolutely.
Okay, thanks.
So next big thing for the program, obviously Vigorous is going to continuing to learn Vigorous in program year 24, is the incremental funding amendment applications for program year 25. That's the grant recipients that all start with a bunch of zeros. You're either going to be entering in your second or your third year for program year 25, which starts July 1st, 2025. We're going to issue a policy around the beginning part of December that will outline the suspense dates and when we will hold training. The reason why we're going to issue it in December, the GO memo plus the technical assistance guide, is to give you and the GOTRs time to work on becoming proficient in developing the product. I'll have to say to all the grant recipients on this call, who are familiar with the term conditions of award, it means that you were successful in submitting your incremental funding application, but there were some things that were wrong, so you now have to submit an amendment correcting things. Of the 126 grant recipients that were eligible for incremental funding, 3 had conditions of awards. You all did great, and we're going to continue to develop our products so that you will do great. So by issuing the policy earlier with its suspense date that will be on or around the same time in the winter of 2025, February, March timeframe, will give you the opportunity for those that are new to learn and study it. But a spoiler alert this year, the grant recipients may get a checklist, and that checklist might enhance your technical application of following the guide on how to fill out everything you need for incremental funding. And then a little bit before time that it's due, we're all going to get together and we're going to workshop, and I'm going to talk to you all about some of the things that are common errors that result in returns. So I'm really looking forward to doing that. I know that's, we're talking about probably about 110 amendments are going to have to come in through our office, but I enjoy giving our grant recipients and you all clear guidance. So hopefully the products that get you funded for the next program year, it'll be easy for you to complete, and then you can move on and just stick on to the important things like providing services to our veterans. So on or around that time, we'll have an update probably on the FY25 FOA. If it hasn't been announced, then you'll have an update as to around about when it will be. And then we'll do a check-in. We'll check in on VPL 0624 and maybe do a different section of it, depending on the needs that we receive from the grant recipients. Is, as you say, communicate with your GOTRs. If there's things that aren't clear, we can absolutely parking lot it for a future listening session. I think definitely our next listening session will set aside a little bit of time for vigorous in the winter months, but you know, for everyone on this call, thank you so much for your time. We're going to commit to having a robust Q&A document for you. The PowerPoint presentation is on the NVTAC website, and the recording itself will be made available imminently. Through the National Veterans Technical Assistance Center, we will be sending out an email that will announce when all of the resources are available. So thank you so much for all that you do. Thank you for, you know, applying for and executing our program. We hope you're happy with the VPL. We hope you're happy with expanding the eligibility for our veterans that are at risk of homelessness, and good luck with Q1 reporting. And I mean it, and utilize the vigorous inbox as much as you need. Thank you, everybody. Take care.